For people suffering from an immune deficiency, immunity therapy can be life-saving. It's called IVIG, an intravenous treatment that's also effective for certain autoimmune disorders and neurological conditions. But it is costly, and now many insurance companies are clamping down on covering it with devastating results for patients. Gram for gram, this fluid is more expensive than gold. It's intravenous immune globulin, or IVIG, a biological product derived from human blood. For patients like Dominic Spatafora, it's far more valuable than gold as well.
This was an absolute miracle drug. From my very first infusion, I gained back the use of my fingers. The tremors stopped completely. It went away. All my symptoms just disappeared immediately.
Dominic suffers from multifocal motor neuropathy, a debilitating neurological condition that can lead to paralysis.
Probably at 2 or 3 spots along the course of the nerve, antibodies kind of get into the nerve and inflame it and interfere with its function. And the treatment IVIG is able to get rid of antibodies and inflammation.
For Dominic's condition, IVIG is considered a first-line defense, even though it's not FDA approved for his neuropathy. In 2005, Dominic's health plan told him it would no longer cover his $80,000 a year treatment, a decision that coincided with Medicare's lowering the reimbursement rates for IVIG.
I did wake up one Sunday morning, I will never forget this, and I completely lost the use of the fingers in my right hand. Being 31 years old at the time, owning my own business and relying on a BlackBerry, it was absolutely devastating.
So we know that it works. But even despite knowing all that, some payers will say it's not FDA approved, which makes everybody furious because everybody's sitting there scratching their heads and saying, who cares if it's FDA approved? This thing works perfectly well.
Advocates point out these denials can have deadly consequences.
We know of 9 Medicare patients that have died so far.
Michelle Vogel heads the nonprofit Alliance for Plasma Therapies in Washington, D.C.
So we're hearing more and more patients getting letters from their insurance companies or getting their explanation of benefit forms saying that their therapy is now considered experimental or medically not necessary after being on IVIG for years and it being effective.
That's what happened to Simone Biasi. After 3.5 years on IVIG to treat her multiple sclerosis, her insurance is no longer paying for it.
It's costing about $4,000 a month.
She's paying for it herself for now while appealing her insurance company's decision and trying to stretch her monthly treatments.
I went as far as 8 weeks at one point, and I got to the point where I just felt like old symptoms were back, and I couldn't lift things, and I couldn't, it's just like I didn't want to walk.
With IVIG, she's been able to work and take care of her grandson.
When you talk about cost, you're not just talking about the cost of the infusion of the medicine, you're talking about the cost of somebody being sick and missing work and being depressed and having an arm that doesn't work, and that is clearly another kind of cost that's incredibly important.
Neurologist Jonathan Katz at California Pacific Medical Center has seen miraculous results with IVIG for some patients, but not all will react the same. The only way to tell if IVIG will work, he says, is to try it, and then it must be carefully monitored.
And then you have value judgments in the middle.
These are really rare disease groups, and it has to be done based not just on the clinical and science, but based on what the physician sees treating the patient and how the patient reacts.
And problems with access are expected to grow worse. Medicare just announced another cut in reimbursement rates, this one impacting hospitals. Meanwhile, the demand for IVIG has risen sharply in the past decade, according to an analysis by the Department of Health and Human Services. Since IVIG is derived from blood, there is not a limitless supply, making the price volatile. Simone says she won't give up fighting for her share.
I've seen what happens without it. And I just, I don't feel it's worthwhile being here. If I have to be in the state that I was in before.
It's scary. I mean, it's just awful that there's a drug that could keep you alive and that your doctor prescribes for you, knows that it's helping you, but yet you can't get it.
Dominic won the battle with his insurance company, regaining his IVIG and the use of his hand, but he's still worried about the future and other patients being denied their treatment. Last year, he created the nonprofit Neuropathy Action Foundation. In March, Dominic organized this news conference on the Capitol steps in Sacramento to draw attention to the IVIG crisis. He's advocating Medicare readjust its reimbursement rates for IVIG, and he's looking to California's delegation in Congress to help.
We want them to act. We want them to act now for the benefit of their constituents, and we want them to save lives. We want them to prevent any more deaths, unnecessary deaths, from occurring.
Protecting a liquid lifeline. Now, the California Association of Health Plans tells us members have a well-established option to ensure they are covered for medically effective treatments. It starts by asking their plan for an independent medical review. And you can read the full statement at ABC7news.com, along with my backstory on the Medicare changes that are impacting IVIG.
And impacting patients so profoundly.